You're ready, Dr. McGraw.
This is Dr. McGraw with Active Care Chiropractic. Today we're going to be discussing overpronation. Of course, overpronation is when the foot tends to roll inward towards the big toe. The problem we see is we do see it with runners, but we even see it with those patients that have to stand for their job, so nurses, things of that nature. Typically with us, what we tend to treat with an overpronated foot is we treat the muscles, the tibialis anterior, which is a muscle that runs along the front of the shin, because that will develop scar tissue in it. And typically we see ankle, knee, hip, and of course low back problems. So those are the areas that we concentrate on. Today, luckily, we are joined by Michelle from Fleet Feet, and she's going to discuss real quick on what you can do before it becomes a problem and what shoe to look for.
Hi, thank you, Dr. McGraw.
You're welcome.
My name is Michelle. I am from Fleet Feet Sports in Wilmington, North Carolina, located in the Forum Shopping Center at 1125 Military Cutoff Road. When it comes to overpronation, what I find a lot is if people have not really been diagnosed with that, they'll come in and you look at their foot and the footwear they're in, and it is just totally inward compressed in terms of the interior portion of that shoe. So what we look for is to put them into the category of a stability shoe. So what makes a stability shoe? It's the foam system on the interior side of that shoe in the heel arch area is a little bit more dense, so it slows the rate of that pronation. If you're not in that, if you're in a neutral category shoe, that cushion compresses as that person puts that pressure or weight as they're rolling in. So slowing the rate of pronation helps, but it doesn't actually help solve the whole entire problem. So what we find is putting an insert into that shoe actually then gives support and stability to that arch, which keeps the alignment better within their foot, their ankle, knee, hip, lower back. So hopefully reducing the stress that causes all the injuries and issues that you indicated earlier. So it's not necessarily just a shoe. We look at that entire footwear system to really help somebody dealing with overpronation. And as you mentioned, it's not just for a runner or a walker. If you are on your feet all day, creating that whole system again for the footwear you're in. And there is an option in terms of a running shoe you can wear as at work, or if you are in like dress shoes, there are dress shoe inserts, so that can help as well.
Awesome. So that's overpronation. The biggest thing that we touch upon, of course, is the foot, but as Michelle pointed out, it will involve the entire leg when it becomes a problem. So give our office a call. Thanks for stopping by. We'll get you in the right shoe or get you the right people as well. Thank you.